For being late. Am I live? Am I visible? Give me a thumbs up in the chat box. Osama, am I live? Give me a thumbs up. Anyone else? Can you see me? Can you hear me? Give me a minute to confirm. Give me a minute. Yes, I guess it's working. Is the audio good? Okay, yes. So yes, let me start. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sajdev here. So with this refreshing morning, today I'm going to start a new topic, an important topic which is very important for the theories as well as MCQs. Breast cancer, one of the most important cancer for exams from which many MCQs are asked, right? Yes or no? Yes, no? So many MCQs come from this topic. So let's study this topic in detail. The most important, the latest advances in breast cancer is the molecular classification. Now, most of the questions comes on the molecular classification apart from histopathological classification. So, I will teach you both classification, the histopathological classification as well as molecular classification. So, let's start. Without wasting any further time, let me teach you breast cancer, right? So, okay, before starting this session, first, I will give you a brief overview about the structure of the female breast, right? Now, the breast cancer, 99% it occurs in females, but 1% it can occur in males also. So here, first I will teach you the structure of a female breast before starting the breast cancer so that you will have a better understanding of the histopathology of the breast cancer. As usual, let me start with normal. Can I start? I guess I must. So let me start with the normal structure of the female breast. We know what is breast. Breast is a modified skin appendage. Breast is a modified skin appendage, right? It is functional in females only during lactating period. Otherwise, it's non-functional in females also. In males, throughout the life, it is rudimentary, right? So we know that. So this is the breast, the female breast. This is the structure. Let me explain you the structure in detail. Right, now in the composition of the female breast there are two components, the epithelial component and the stromal component, right? So 90% component is the stromal, the background stroma, the fat is the background, the stroma, and only 10% component is the epithelial. Can you see the background yellow color? I guess you must, right? The background yellow color, you must. Okay, let me show you. If you have any confusion, let me show you. I'm talking about this background. The background yellow, right? That is stroma, that is fat. So 90% of the breast is fat only. The fat is the stroma, the adipose tissue. So this is known as stromal component. Can you see? I have highlighted the stromal component. Now apart from stromal, whatever you can see, the ductules in the between and the acini and the glands, that is all epithelial component. That makes only 10%. Now breast cancer is a cancer of epithelial component, not stromal component. So breast cancer occurs in that 10%, the epithelial component, not in 90% stroma. Give me a thumbs up if you got it. So give me a minute. Let me come. Okay. So are you people there? Can we go ahead? Have you got it? So this is the diagram. Now let me explain you this diagram in detail. Right. Now the entire breast is divided into multiple C. What I am talking them. So can you see these small structures, the circular structures? These are known as glands or acini or ductules. One and the same thing. Either call them acini or call them ductules. Or call them glands, one and the same thing. So multiple glands or ductules are there which synthesize milk during lactating period of the female. So milk is synthesized in them. The cells lining them, the red color lining I have drawn, they synthesize the milk. So that is for the milk synthesis. So there are multiple acini, multiple ductules in the gland, number one. Now the second point you have to understand after this is that multiple acini or ductules open in one terminal duct. So can you see here is one terminal duct taking all these, here is one terminal duct, here is one terminal duct, one. So multiple glands open in one terminal duct. Give me a thumbs up on this point if you got it. So that is the second point. The third point is that multiple terminal ducts open in one lactiferous duct. So this is one lactiferous duct, this is another lactiferous duct, this is another lactiferous duct. So lactiferous ducts, multiple terminal ducts open in one lactiferous duct. That is my point to explain you. I guess you got it, right? Now multiple lactiferous duct at the end, they come and open in a sinus. This is known as lactiferous sinus. So milk is ultimately collected here, right? lactiferous sinus, and it opens in the nipple of the female. This is the nipple. So whenever the baby sucks, so all the milk present in the sinus, it goes to the mouth of the baby. Give me a thumbs up if you got it. Give me a thumbs up. So this is the structure of the breast. Can you tell me? I would like to draw the structure again for you. So let me draw a female breast here. A rough diagram to explain you what is TDLU. Let me explain you what is TDLU now. So this is the female breast. Let me draw. So these are multiple acini. Let me draw few acini for you just to explain you. These are multiple ductules or glands or acini, whatever you call about. So these are that, right? Now multiple ductules or acini open in terminal duct. So this is one terminal duct. This is another terminal duct, right? This is another terminal duct. I'm drawing a rough diagram. Okay, this is another terminal duct. Now multiple terminal duct open in lactiferous duct. So this is one lactiferous duct in which this is also opening. This is one lactiferous duct in which this is opening. This is opening. Now multiple lactiferous duct, they will come and form a sinus here. A sinus here. This is known as lactiferous sinus, and it will open in the nipple. So this is the rough diagram. Everyone give me a thumbs up. Everyone. Now this structure is known as, yes, I'm coming on that, Gaurav, TDLU. What is the full form of TDLU? It is terminal duct lobular unit. Now terminal duct, you can understand. The blue structures are the terminal duct. What is a lobule? What is one lobule? What is one lobule? Multiple acini in one terminal duct form one lobule. So this is one lobule, this is one lobule, this is one lobule, this is one lobule. So multiple glands, when they open in one terminal duct, they form multiple lobules. So we divide the complete breast into multiple lobules. Multiple lobules. Give me a thumbs up if you got it, right? So this is the structural and functional unit of the breast is TDLU. Like the structural and functional unit in kidney is glomerulus, right? The nephron. In the same way, the structural and functional unit in the breast, the female breast, is TDLU, in which the milk is synthesized as well as secreted. The complete function is there. Everyone give me a thumbs up. I guess everyone got it. Yes? Can I go ahead? Can I go ahead? Can we go ahead? Give me a thumbs up if you go ahead. So Sonal, I have not taken antiplatelet yet now, but I will try to cover it soon, right? So are you people there? Okay, I must go ahead. So this is the structure of the female breast. I guess you got it. Say yes. So the complete breast is divided into multiple lobes. The multiple lobes divided into multiple lobules. In one lobule, there are multiple glands or ductules or acini. Multiple glands or ductules open in terminal ducts. Multiple terminal ducts open in lactiferous duct. Multiple lactiferous duct open in lactiferous sinus. And this complete structure is known as TDLU. I have explained you this. Come on, give me a thumbs up. Gaurav, Osama, I am waiting for that. Can we go ahead? So this is the structure of female breast. As I have told you, the breast cancer arises from TDLU. All the breast cancer arises from TDLU. Now let me tell you the lining of the TDLU. The lining. Now this complete diagram. Can you all see this complete diagram? See this acini or ductules, these terminal ducts, these all terminal ducts, and these all lactiferous duct. What is the lining of them? The background is the stroma. I am not talking about the fat. I am not talking about the stroma. I am talking about this TDLU. What is the lining of this TDLU? This TDLU have a double lining, the outer and the inner. So what is the double lining? What is the outer? What is inner? So it is having a double lining. The inner is epithelial and outer is myoepithelial. Let me show you. If I cut this portion of the breast, or if I take a biopsy and make a slide, this is the slide. What can you see? What are these circular structures? Can you see multiple circular structures? So these circular structures, maybe these ductules are there. Maybe circular structures are these terminal ducts. Maybe the circular structures are these lactiferous ducts. Anything can be there. So basically it is TDLU. It can be anything. It can be multiple glands. It can be multiple terminal ducts. It can be some of them maybe lactiferous duct. So ultimately the lining is double layered. Can you notice double layer here? Let me show you the double layer. The inner layer is the epithelial. You can see these all cells are epithelial, right? And if you see it properly now, you can see a flattened cell also. Just lining this. This is myoepithelial cell. The myoepithelial are the flattened one. So epithelial and here you can see, I guess, better diagram. You can see this one is the epithelial. Yes. And this one is the myoepithelial. Myoepithelial. Okay. This one, the myoepithelial is the flattened one. So basically it is a double layered. You got it? We have different immunohistochemistry we can use to highlight the different type of lining. Anyways, this is the structure of the breast and the background is the stroma. I've already taught you the background is the stroma. The stroma is the adipose tissue. 90% is the yellow color stroma, the adipose tissue. You can notice it here. You can notice the background is the stroma. So this is the complete structure of the breast. If we have understood the complete structure of the breast, we can start the carcinoma of the breast. Can I start? I must start the carcinoma of the breast, right? Okay, yes. The carcinoma of the breast. So if it is coming in your university exam for a long question, you must write at least 5-6 pages on that. So you must divide the carcinoma of breast, this topic, under following headings if it is coming in your university exam. You must write the introduction, clinical features, the risk factors, the classification, the two type of classification, histopathological and molecular, the most important molecular, individual tumor microscopy, grading, staging, right, prognostic factors, and molecular classification we already included here, right? So these are the headings you must write, right? If you are writing, you will get full marks. But if you have already passed your second prof and preparing for university exam, these all headings are important for you also, because many MCQs asked from each and every heading. So let me discuss these headings one by one. Let me start with introduction. What is the age of breast cancer? The most common age of breast cancer is perimenopausal. So we consider in a life of a female, the female is born. This is the birth of a female, and this is the death of a female. This is the death of a female. I'm talking about a female life, right? So at 13 to 15 years of age, she has menarche. Menarche. In the menarche, the ovaries get functional and menstruation is started, right? And at around 50 years of age, this is 15, and this is at around 50 years of age, menopause is there. In the menopause, the ovaries again get dysfunctional and menstruation stops. So this period is considered as reproductive period in the life of a female. The female can reproduce for 30 years, almost 30 to 35 years, and this is the reproductive period. Before this, after this, the female cannot reproduce because the ovaries are non-functional. The ova cannot be formed. Without ova, she cannot reproduce. So this is the reproductive age of a female. Now in this complete life cycle, where is the most common age of breast cancer? So breast cancer occurs around menopause, before 5 years before that to 5 years after that. So 45 to 55 years of age is the most common age group in which 90% of the breast cancers occur. Now it can occur after that also, it can occur here young age also, right? But rarely. 90% of the breast cancer are clustered in perimenopausal. So menopause के दोनों side, इसलिए मैं कह रही हूँ perimenopausal, थोड़ा पहले थोड़ा बाद में. Give me a thumbs up. Come on, give me a thumbs up. You got it? Say yes. Right? So say yes. What you are asking, Gaurav? Ma'am, what's the inter and intralobular stroma? Inter and intralobular stroma is also fat only, Gaurav. So here it is not related to the carcinoma. That's why I have not told you. So as I have told you, the breast is divided into multiple lobules. So stroma is everywhere in the background. So the stroma which is present in one lobule, the background. What is one lobule? Gaurav, what is one lobule? Let me draw one lobule. So this is one lobule. So all the acini opening in one terminal duct. This is one lobule. Let me draw one more lobule for you to explain you. This is one more lobule, right? Gaurav, can you see I have drawn two lobules? Now let me draw the stroma to explain you your question. Okay, you are asking, so the stroma present around this lobule. This is interstromal, interlobular stroma. This is also interlobular stroma. Now, but the stroma connecting these two, I guess you got your answer. The stroma connecting these two, this stroma is intralobular, I guess, but it is fat. Everything is fat. I guess you got it. Give me a thumbs up, Gaurav, if you got it. So that is the stroma we can divide into two categories, but it is not important. It is not related to the topic. Can we go ahead? Can we go ahead? I guess, right? Okay. Give me a minute. Okay. Okay. So we are done with the age. The most common age group is the perimenopausal age group. Perimenopausal. What are the clinical features? When any lady coming to you with breast cancer, what she will complain? She will come and she will complain, doctor, I'm having single. It's always solitary, right? Mostly. Solitary, painless. I don't have any pain in that. Painless, palpable lump in my breast. So in the breast, she may experience a solitary, painless lump. So only thing she can palpate it. It is painless. That's why the diagnosis is delayed most of the time. Now in India, developing countries like India, not only India, in developing countries, it is the mentality of the people that if something is not giving any pain, it is not harmful. But it is a misconception. The breast cancer is painless cancer. It doesn't cause any pain. So educate all the females around you. Any female around you who is 45 to 55 years of age, your neighbors, your relatives, anyone, your patients, So educate all the females that breast cancer is painless. So you should, all the females in this age group, they should palpate. Self breast examination they should do once a month. And if she feels even a single small nodule as small as 0.1 centimeter also, that should be diagnosed. That should be done FNAC or that should be done mammography or diagnosed. So it is painless. It is painless. The point is that it's painless. You got my point? So it is solitary, painless, palpable lump detected usually by the self-examination, and then the female will come to the doctor. Usually females, it is painless now. वो घरेलू नुस्खे ही करेंगे कि ठीक है ऐसे ही होगा, it will get subsided. They don't have awareness about that. They don't have knowledge about that. So it will get enlarged. So the staging is increasing. Initially up to 2 centimeter it is stage 1. 2 to 4 centimeter it will become stage 2. After 4 centimeter it will become stage 3. And once it's involved the skin and the pectoralis muscle, it will become stage 4. It is incurable. So the female should not wait. As small as that, before 2 centimeter size only, it should be treated. You got my point? For that, awareness in the society is required, which can be given by the doctors only, right? So all the ladies around you, give this awareness that breast cancer are painless, and all the ladies in this age group, they should palpate their breast at least once a month. Even a smallest lump should be diagnosed. Now, how to do the diagnosis? So for diagnosis, we have triple technique. The most important is the self palpation. So lady, as I have told you, once a month, she should do self-palpation in all the 4 quadrants of the breast. If she palpate any smallest nodule, that should be diagnosed, number 1. Number 2 is mammography. Can you see, in the mammography is the best technique in which we can diagnose the breast cancer, right? So mammography can be done. Mammography second. And third is FNAC. What do you mean by FNAC? What is the full form of FNAC? Osama, what is the full form of FNAC? FNAC is fine needle aspiration cytology. FNAC. What is the difference between FNAC and biopsy? Can you tell me? So what basically we are doing in FNAC? In the FNAC, this breast lump is palpable. Can you see? It is palpable here. You can palpate it. You are a doctor now. So this is done by pathologist, right? The first thing, FNAC is not done by the clinician. It is done by pathologist. So if it is large enough that you can palpate it, you just hold it like the doctor is holding here. Can you see the doctor is holding the lump? So just hold it. Take a needle, the anti-syringe, take an anti-syringe with a needle, a small needle with a small bore, right? So usually we take 26 gauze or 28 gauze, whatever works, right? With such a bore that the fluid should go in. Itna patla bhi mat le lena ki fluid in na jaye, right? So a medium bore needle you have to take with an anti-syringe, right? You just put the syringe here and you just do like to and fro movement. After that, it is little bit painful. We don't give any anesthesia usually. The lady have to bear a little bit pain. We don't give any anesthesia. I'm repeating again. Daily I do this technique in my hospital. I work in an oncology center, right? So in oncology center, daily we get 2, 3, 4, 5 ladies with this technique. I perform on them daily. It is my routine job. So that's why I'm telling you the detail. So just hold the lump, not only in breast, wherever in the body, just hold the lump. Put the needle, do to and fro movement. That's basically when we do the to and fro movement, now the cells will get dislodged. The cancer cells will get dislodged, right? It will get dislodged. And after that, itna bhi aisa nahi karna hai, halka sa, like thoda sa. And after that, pull the plunger, the syringe plunger, pull the plunger out. So whatever cells are dislodged here, they will come and they will get collected here in the syringe. So you are getting a small amount of fluid containing the cancer cells, if cancer is there. We don't know whether it is benign or malignant. No, we want to know that cancer are of 2 types, benign, malignant, right? Both have different treatment. So we want to know lump hai to cancer hai. Lump means cancer, right? It has to be operated. But if it is benign, only surgery is required. But if it is malignant, chemotherapy, radiotherapy, hormonal therapy, targeted therapy is also required, right? And chances of metastasis are there in malignant, not in benign. Benign are safe. Okay? So you want to know that. So you have taken the fluid contains the dislodged cells, take them on a slide, stain them, just stain them and see under microscope. So in the microscope, looking on the cell, you can see whether it is a benign cell or malignant cell. So it is a cheap technique, number 1, right? Require less expertise, number 2. Number 3, the results can be given in few hours. So just I take the sample, after staining it, I can give the results as small as 15 minutes, 20 minutes. The time is required only to see me under microscope. If I'm experienced, I can give the result within 15. So in case of emergencies, I can do that. I can do that, right? So very less time is required, right? But you know, the biopsy is the best one. But biopsy is costly. In biopsy, we don't take out the cell, we don't take out fluid, we take out a solid tissue. यहाँ से एक छोटा सा टुकड़ा काट के निकालेंगे. We will take a small amount of tissue here. Tissue. I am taking the word tissue. So there is a biopsy gun with a knife. For that, we give the anesthesia. It is a very painful procedure, right? So we give a local anesthesia and we take a small tissue, take it out, and we make a block of it and histopathology HNE stain karte hain. It requires 2 days to get reported, right? But yeah, the more appropriate diagnosis is on biopsy. That is about FNEC and biopsy. So usually we do FNEC because it is simple, cheap, results can be fast, right? In case of confusion, we go for the next step is biopsy. So this is triple technique. Can you tell me what is triple technique? Can you tell me what is triple technique? Number 1, breast self palpation, you can see. Number 2, mammography, you can see. And number 3, FNAC, you can see. Give me a thumbs up. This is known as triple technique. Now, what are the risk factors of breast cancer? Can anyone enumerate? Gaurav, Osama, do you know what are the risk factors of breast cancer? There are 12 risk factors. Can you enumerate them and explain me? So many ladies around me, they always ask me, doctor, you work in an onco center, you work in a cancer hospital, you are an expert in cancer. So can you tell us the risk factors of the breast cancer? One of my relative was having breast cancer. So are there any risk factors so that I can avoid them? I don't want that breast cancer should happen to me. So you should be answerable to them. ऐसा नहीं बोलना वो तो भगवान के हाथ में है, ऐसा नहीं. Every cancer have a risk factor. You should be able to enumerate them. These are the risk factors of breast cancer. What are they? What are they? Osama, no. Smoking, alcohol, unmarried girl is to a little extent, but smoking, alcohol have a little role here in breast cancer. Yes, family history, of course. Okay, let me enumerate them. Let me enumerate the 12 risk factors. The 12 risk factors. Some of them are modifiable. You can modify them. Some of them are non-modifiable. The first is the geographical and racial, right? Breast cancer is more common in developed country as compared to developing country, right? So initially, breast cancer was the most common cancer in US, in the world, but not in India. In India, in females, breast cancer is the second most common cancer. The most common cancer is cervix cancer in India because of early marriage of the girls here. But now India is also adopting the Western culture. So in India also this year, breast cancer is the most common cancer in females. So basically breast cancer is the most common cancer in females, right? Usually it is more common in developed countries. So that is according to the geography, whether the female is in developing country or developed country. So that is the risk. That is a risk. It is more risk in the developed country, less in the developing country. Racial factors. Breast cancer is more common in Hispanic females and African American females. African American females, right? So these are the two, geography and racial. You got it, the number 1. Number 2 is family history. As Osama was saying, family history. So family history, if any lady, any female have someone in the first degree relative having breast cancer, she is at high risk of developing breast cancer, as her mother or her sister is already the real sister and the mother, that is first degree relative, have breast cancer. So she is already at 6 times more risk of developing breast cancer as compared to another female who doesn't have any family history of breast cancer. So that is the point. Number 2 is family history. So number 1, geographical racial. Number 2, family history. Number 3, the most important is the menstrual and obstetric history. What do you mean by menstrual and obstetric history? As I told you, in the life of a female, this is the birth of a female. This is the death of a female. Usually we take the lifespan of 65 to 70 years. Okay? This is the menarche, and this is the menopause. Menopause, right? Now listen, it's very important. During this period, the female is exposed to estrogen. Say yes, because here the ovary get functional and here ovary get dysfunctional. So this period, the blood of the female contain estrogen because ovaries are functional during this 30 years. Say yes, you got it? So here 15 to 45 years. For the 30 years, in the blood of the female, estrogen is present. Now mind my words. Estrogen is directly proportional to breast cancer. The more exposure to estrogen, the more chances that the lady will have breast cancer in future. You got my point? So you will say, ma'am, how to reduce this risk? So estrogen is already present in the blood. How we can reduce it? How? It is present in the blood during the 30 years of reproduction. So listen, the ladies which have early menarche, instead of 15 years, nowadays menarche is shifted to a little bit earlier age. Early, at 10 years she is having menarche. So this 5 years are additional. So the ladies which have early menarche are at increased risk of developing breast cancer in future, because she have additional 5 years or few years of estrogen exposure. The ladies which have late menopause, instead of 45, the menopause is at 50, 55, sometimes it happens. So the additional years added is of estrogen exposure. So early menarche and late menopause, both are risk factors of breast cancer. Give me a thumbs up. Give me a thumbs up if you got it. So early menarche as well as late menopause, because both of them are causing the same thing, increasing the years of estrogen exposure in the lady. That is the point. Give me a thumbs up if you got it. Give me a thumbs up. Yes, yes. So that is the thing. Now next thing. अब ये तो हो गया menstrual history. Menstrual में दो ही चीजें हैं, early menarche और late menopause. Now let's talk about the obstetric history. During her lifespan, she get married. After marriage, she get pregnant. She can have 1 pregnancy, 2 pregnancy, 3, 4, multiple pregnancies she can have according to their wish, right? Now during the pregnancy, in humans, the gestational period of pregnancy is 9 months, 9 days. Usually it's 9 months, 9 days, normal term pregnancy, right? During those 9 months, in the blood, progesterone is there, estrogen is not there. You got my point? So out of this 30 year, the more she become pregnant, more times she become pregnant, that 9 months will be deduced from that 30 years. You got my point? So during those 9 months, she don't have estrogen in the blood. She have progesterone in the blood. So the point is that the more number of pregnancy, less chances of breast cancer. You got my point? That's why it was less in India initially, because initially, you know, my grandmother has 6 child. So she was pregnant 6 child. You know, in that era, it was very common to have 6 child, 10 child. You got my point? So the ladies become pregnant multiple times. So the chances of breast cancer are less. You got my point? But now India is also adopting the culture of the Western cultures. So less child, you know, or we can say nulliparity is also common here. So the lady which is not pregnant throughout the life is at highest risk of developing breast cancer, I must say. The nulliparity is increasing the risk, and multiparity decreasing the risk. You got my point? Give me a thumbs up. Nulliparity and multiparity, both of them. Yes, I'm coming on that point, Gaurav. You got my point? Here, you got my point. Now listen, as Gaurav is saying, so after pregnancy, the child is delivered. The first child, the second child, the third child. So for the next few months or few years, the lady lactate the child, breastfeed the child. You got my point? Till the time the lady breastfeed the child, at that point also she have progesterone. She don't have estrogen. So more she do breastfeeding, the less chances she will have breast cancer in the future. So breastfeeding is a double advantage. Advantage for the baby, advantage for the mother. So if the mother is doing breastfeeding to the baby is getting nutritious milk from the mother, right? So baby will be healthy, less infections, and mother is decreasing her own chances of developing breast cancer in future. Give me a thumbs up, because the more time she will breastfeed, she is having progesterone and she is decreasing the risk of estrogen exposure to that point. So all the ladies, all the mothers should breastfeed their babies. Give me a thumbs up if you got this point also, right? So that is about the menstrual and obstetric history. I guess you got it. You got it? Say yes. Yes. So it is written in front of you. You can read it. So early menarche, late menopause, nulliparity, they all increase the risk. The point is that only because of all these 3 things, estrogen exposure increases, and estrogen increases the chances of the breast cancer. Right? Early menarche, late menopause, and nulliparity. You got it. You got it. Now imagine a lady, there is a lady, she is having menopause. So she is 45 years of age. These are the ovaries of the ladies. They become non-functional and she is just 45 years of age and she is having menopause. You got my point? So at menopause, there is sudden cessation of estrogen. Now she don't have estrogen in her blood. Suddenly the ovaries become non-functional, right? Now estrogen, apart from reproductivity, estrogen causes ovum secretion. Apart from it, it is having other functions also in the body. The mood stabilization in the females is because of estrogen. It is to some extent, right? Mood stabilization, the bones, right? Now since the estrogen in menopause, it is just suddenly withdrawn from the blood now, so this lady can go in depression. Right, this lady can go in depression, the bones can become weak, right? She may have hot flashes. You got my point? So many complaints she will have. These all complaints are known as menopausal complaints. Since the lady is in menopause, that's why she has all these complaints. So all the ladies which undergo menopause have all these complaints for the few months. Then they adjust their body and their body is adjusted after that, right? But some ladies have these complaints too much that they can't bear it. They go in severe depression, right? Mood instabilization. They have severe hot flashes. Their bones become too weak. They become osteoporotic. They have fractures. So sometimes these symptoms are very severe. So at that point, what is your job? You're a doctor. Now she will come to you, doctor, I'm having this symptom, and she will say, after my menopause I'm having these symptoms. Once my menstruations were there, I was not having these. My menstruations are stopped now, and now I am having all these symptoms. Please treat me. I am having trouble. So you will give external estrogen to this lady. External estrogen in the form of the tablets, and gradually you will decrease the dose over the years, gradually. Because if you are reducing it suddenly, she is having the symptoms, right? This treatment is known as hormonal therapy. What it is known as? Hormonal therapy. Hormonal therapy is very common in India. Many females have these complaints, right? They go to the specially gynecologist or many physicians, and physicians offer hormonal therapy to them. So basically, by giving hormonal therapy, you are causing delayed menopause. Yes, what you are causing? You are giving hormonal therapy to treat some symptoms, but basically you are delaying the menopause and you are increasing the estrogen exposure in the body. This is not natural but artificial estrogen. Estrogen is estrogen. So you are increasing the risk of the breast cancer by giving hormonal therapy. Can I say this? Yes, I can say this. Give me a thumbs up. Give me a thumbs up. You got my point? Say yes. So this is the point. Okay. And after that, one more point, let me explain you here on. See, imagine one of the lady in young age, 25 years of age, she is having ovarian cancer, right? So both the ovaries are removed. Oophorectomy, bilateral oophorectomy is done. So at 25 years of age only, she is having menopause because of some diseases in the ovary. So she is reducing the risk of the breast cancer in future. So by various ways, ultimately it is related to estrogen. You have to relate everything with the estrogen, right? So if you are giving menopausal hormonal therapy to the lady to subside the depression and other symptoms, you are increasing the risk of the breast cancer, right? If you are doing oophorectomy in some ladies, right? So you are reducing the risk of the breast cancer. You got my point? And drugs that block the estrogen. Okay, there are some drugs which block the estrogen synthesis in the body, so that will decrease the risk, right? So what MM is asking? MM is asking, having multiple children is good, early marriage. MM, your answer is very diplomatic. My answer will be diplomatic. What I am saying, listen, my point is that early marriage and multiple children is good for breast cancer, right? Having multiple children, you are reducing the chances of the breast cancer, but you are causing population explosion. So you should not advise your patient to have multiple children to avoid the risk of the breast cancer, right? So that, you know, it is a double-edged sword. The one couple, the lady is having multiple children, on one side she is reducing her risk for breast cancer, but you know, multiple children hone ke there are other various disadvantages. The disadvantages are more than advantage. Advantage to ek hi hai, lekin disadvantages are multiple. You got my point? So we cannot advise that. That is my answer to you. You got my point? So that is the thing. Yes, functional ovarian tumor, Gaurav, will increase the risk. The ultimate point, you have to relate with the estrogen. Just relate with the estrogen. So coming to the next risk factor. Next risk factor is fibrocystic disease. Fibrocystic disease is a benign disease in the breast. If the lady is having this benign disease in the breast for a year and she is not taking treatment for that, she is increasing the risk of the breast cancer in the future. Dietary factors, as someone was saying, now smoking alcohol is a risk factor for the breast cancer to a lesser extent. The ladies who smoke, the ladies who drink alcohol, and the ladies who consume large amount of animal fats, the non-veg and high calorie food, they are obese, they increase the risk of the breast cancer. So these are the dietary factors, right? Exercise has a protective role. The more lady is doing exercise, the less chances of breast cancer she will have in future. So exercise have a protective role, because by doing exercise she will reduce her weight. Overweight, obesity is a risk factor, right? By exercise she will be physically active and she will reduce her weight and she will reduce her chances of breast cancer in future. Give me a thumbs up. Exercise have a protective role. So I advise all the ladies in your contact, in your surrounding, they should be physically active. They should do more and more exercise, right? Breast densities, different females have different density of the breast. The female whose breasts are very dense, they have high probability of developing breast cancer in future, right? Environmental toxin. In the environment we live, we eat, we drink, we inhale, there are various pesticides are present. So that also increases the risk. Nowadays, it is a fashion to eat organic food. Organic food is what food? Organic food is free of pesticides, they claim. So it is very costly. You know, they claim that it isn't, but who knows whether it contains or don't contain. So pesticides increases the risk of many cancers. One of them is breast cancer, right? The next is the radiation exposure to the chest. What do you mean by that? Imagine a girl, a 10-year, 15-year-old girl, and she had Hodgkin or non-Hodgkin lymphoma in the childhood. She is a small girl, right? And during she is having lymphoma. Lymphoma can happen to the children also, right? Hodgkin's or non-Hodgkin's, whatever. And for this, she is having mediastinal lymph nodes. The mediastinal, other lymph nodes are also enlarged, but mediastinal lymph nodes are also enlarged. To treat it, you are giving radiation exposure to the chest. You are giving radiation exposure, radiotherapy. You are giving radiotherapy to the chest. For the treatment of lymphoma, we give radiotherapy. So specifically, you are giving to the chest. But in the chest, she is also having a breast. So the breast also get exposed to radiation unknowingly. So in future, she is having high chances of developing breast cancer because in her childhood, she is exposed to the radiation, right? That is one of the example. Or you have heard about the Hiroshima Nagasaki atomic bomb explosion. You may have heard about other radio explosion. एक और है ना? One more. So many examples are there. Some accidental exposure. उसमें all the females who were exposed to radiation at that time in that Hiroshima Nagasaki exposure, they were having high chances of developing breast cancer or all cancers in the future. You got my point? Yes, Chernobyl. Yes, Chernobyl. So I was remembering that only. The Chernobyl exposure. उसमें बहुत लोगों को future में cancer हुआ था. That is the point, right? The next is the carcinoma in one of the breast. The ladies which is having one breast carcinoma, that is right or left, in future she is having high chances of, or 1% of the ladies will have cancer in the other breast also. And the last is the genetic mutation. Can you tell me the name of the genes which get mutated? Can you tell me the name of the genes which get mutated? Can you tell me? There are 3 genes. The most important is the BRCA1. BRCA1 is present on chromosome number 17. It is an MCQ. It is a tumor suppressor gene, right? If it get mutated in females now, it causes breast and ovarian both cancer in female. And if get mutated in male, it causes prostate cancer in male. ये सब MCQ है. जितना भी red से highlighted है, these all are your MCQs. So BRCA1 is the gene present on chromosome 17. If in female mutated, it causes breast and ovary cancer, and in male it causes prostate cancer. If it is mutated, it is sure that in future 99% chances are there that the lady will have either breast cancer or ovarian cancer. You got my point? And second is BRCA2. BRCA2, what is the full form of BRCA1 and BRCA2? Breast cancer. Breast को लिखो BR, breast, और carcinoma को CA. So it is BRCA, breast carcinoma. BRCA1, BRCA2. That is the full form. Many students don't know the full form. Give me a thumbs up. Give me a thumbs up. BRCA2 is present on chromosome number 13. वो 17 था, ये 13 है. Again in female and male, it causes the same cancer if mutated. In female, it causes breast and ovary cancer. In male, it causes prostate cancer. Give me a thumbs up. Yes, yes. So yes, I'm coming on that point, Gaurav. So if any lady, just suppose she is a girl, young girl, maybe 15-20 years girl, 15 to 20 years girl hai. Her mother have breast cancer in the young age when the mother was young. When the mother was 25 or 30 years of age now, the mother of this girl was having breast cancer. What does it indicate? So this girl is afraid and she is going to the doctor. She is coming to you. Doctor, my mother was having breast cancer when she was young. So I am afraid that will I have the breast cancer when I will be the same age of my mother. My mother was having breast cancer when she was 25 and now currently I am 20. So will I have the breast cancer? So usually age of breast cancer is perimenopausal. I have told you it's 45 to 55. If it is occurring in young age now, you should test for BRCA. In BRCA, the cancer occurs in young age. So you do the BRCA testing in this girl. In this girl, you do the BRCA1, BRCA2 testing, the molecular testing. If BRCA1 or BRCA2 is mutated in this girl, you ask this girl, yes, 100% it's sure that in future you are going to have cancer. The breast cancer and the ovaries cancer. So she will say, doctor, what should I do? We can't modify it. Your genes are mutated coming from your mother. We can't modify it. You will have. There is no escape for that. We cannot save you. The only point we can save you, remove your breast, remove your ovaries. do bilateral mastectomy, do bilateral oophorectomy, then you remove the organ which are at high risk of developing cancer, right? So the cancer occurs in the breast and the ovary. You remove your breast, you remove your ovaries, then you don't have cancer. If you don't remove them, there is a 100% chance that you will have cancer in future. So in some females, we perform prophylactic. The word to be used here, Gaurav, is prophylactic. Prophylactic bilateral mastectomy and prophylactic bilateral oophorectomy, right? You can imagine some of the celebrities have done this surgery. I should not expose the names, but I guess everyone knows it. So some of the celebrities, some actors have performed this surgery, bilateral oophorectomy and bilateral mastectomy, because of BRCA1, BRCA2 mutation. We know that, right? So this surgery is also performed as a prophylactic. Say yes. Say yes. Can we go ahead? Can we go ahead? What you are saying? Huh. Okay. So let me move ahead. So, okay, the third gene is P53. The third gene is P53, BRCA1, BRCA2 and P53. So let's move ahead, and other genes are also there, not really important. Okay, so we are done with the risk factors. I enumerated 12 risk factors. The 12 risk factors, you should be able to enumerate them. Enumeration to learn karna padega, and description give in your own words. If you're a second prof student, don't learn the description. Just try to describe in their own words and enumerate them. What are the 12 risk factors of breast cancer? Give me a thumbs up, everyone. You got it? You got the 12 risk factors. After that, let me teach you some general features of the breast cancer. Breast cancer is very common. Females have two breasts, the right breast and the left breast. She is a female standing in front of me, facing me. So this is the right of a female, this is the left of this female. So breast cancer are more common on the left side as compared to right side. Number one. Right. Now each of the breast, let me draw it. Let me draw it. This is the sternum of the lady. These are the two breasts. This is the right breast of the lady. This is the left breast of the lady. Let me divide the breast into four quadrants. What is the name of these quadrants? How to name these quadrants? You know that? So how to? These two are upper, lower. Same here. Upper, lower. Right. Now outer, inner. The quadrant towards the sternum are inner. You got my point? The quadrant towards the sternum are inner quadrant. So this is upper inner. This is lower inner. Upper inner, lower inner, and the lateral quadrants towards the arms. These are the arms of the lady, right? Towards the arms, the laterality. These are the outer quadrants. So we divide each breast into four quadrant. Upper inner, lower inner, upper outer, lower outer. So this is how the breast is divided into four quadrants. Give me a thumbs up. Now tell me, where is the breast cancer most common? On the right side or the left side? I have told you, it's more common on the left side. In the left side, which quadrant? So 50% of the breast cancer occurs in upper outer quadrant of the left breast. So write down 50% here. It's a general rule. Give me a thumbs up on this point. You can see 50% here. So 50% of the breast cancer on the left side on upper outer quadrant. Upper outer quadrant, it is known as UOQ. Upper outer quadrant, left side. Yes, Osama. Yes. Now let's come on the topic today. Classification of breast cancer. How to classify breast cancer, how you can do the classification of the breast cancer. We have seen the introduction, we have seen the risk factors, we have seen the structure of the breast. Now it's time to learn the classification. I will teach you two types of classification of breast cancer. Number one, histopathologic classification, and second is molecular classification. So based on that, we can divide the breast cancer into various categories. Both are important, but nowadays molecular classification is in fashion. You know, it is coming in your exam many times, in your theory exams also, as well as in your MCQ exams. It's ultra super duper important topic. Very commonly molecular classification based on ER, PR and HER2. So many times, every year question is repeating on them, ER, PR, HER2, right? So let me teach you both type of classification. You want both classification, or shall I directly come on the molecular classification? Let me first teach you molecular today. So if time allows, I will come on histopathological classification also. So let me come on the molecular classification first. Give me 1 minute to jump on the molecular classification. So here I am, the molecular classification. To understand the molecular classification, you must understand the receptors. There are three types of receptors present on the breast cell. The ER receptor, ER is estrogen receptor. PR receptor is progesterone receptor, and HER2, right? Herceptin 2 type of receptor. Three type. HER2 is also known as CERB2, right? The same thing. So these are the receptors present on the surface of the breast. Let me describe them, and based on them, which receptor is present, we will classify the breast cancer into 3 categories, or I'm sorry, 4 categories. So that is the molecular classification. Let me give you the details. So if I talk about the, just a second, receptors, so the first receptor is estrogen receptor and progesterone receptor, ER and PR. They are always taken together. ER, PR, they are taken together. So basically these are the breast cancer. These are the normal breast cancer of any lady who is normal, who don't have breast cancer. So any lady who don't have breast cancer, this is the breast cell. Can you see one of the breast cell? So on the surface of the breast cell, ER and PR both are present. Listen, it is present in normal ladies also who don't have breast cancer, but in low amount. See the amount, 1 ER, 1 PR, in low amount, not 1, but they are in low amount, right? But when the lady have breast cancer, if you see such a lady which have breast cancer, if you see the cell of breast cell, these are the breast cell, the cells of the breast, right? If you see the breast cell of such a lady, you see how much they are increased. They are increased tremendously. ER as well as PR, they increase tremendously. Compare the two. So basically when the lady had breast cancer, ER PR receptor increases tremendously. You will say, ma'am, why it happens? What is the concept behind that? Why during cancer ER PR receptors increases tremendously? You can see here are only few ER and PR, but here they are increasing more than 100 times. Oh my god, during cancer. Why? Because estrogen and progesterone is acting as a growth factor for the cell division of this cell. What I have said, listen. So this cell want to divide. This is a breast cell. This is a breast cell. What is cancer? Cancer is uncontrolled cell division. If this breast cell go on dividing uncontrolledly, right? Uncoordinately, it will form a lump of cells, and that is known as breast cancer. Normally, cell division is under control. It is not uncoordinated, right? But if if the cell division become uncoordinated, the breast cell go on dividing, mitosis, it is not stopping at all. It will lead to a lump of cell, a collection of cell, which is known as cancer. You got my point? You know that, right? I guess. So initially a few receptors were present. I guess this is ER, just for example, this is PR. So when estrogen is coming and binding here and progesterone is coming and binding here, this cell was dividing at that time only. At that time only, from one cell, 2 cells were formed. Right, 2 cells were formed, and they also, the 2 cells which are formed, they also have few ER-PR receptors. So when again ER and PR was going and binding there, they were again dividing into 2 further cells. So the division was slow. The division was controlled, you must say, right? Now imagine what this cell has done. इस cell को बनना था cancer cell. तो इसने क्या किया? अपने ऊपर ER-PR increases tremendously. ER-PR receptors increases tremendously. So in the blood, estrogen, progesterone both are present in the ladies. So more and more estrogen will come and bind here. More and more progesterone will come and bind here. And this cell will go on uncontrolled cell division, numerous cell division. And they will form a lump here, which is known as cancer. Give me a thumbs up. Give me a thumbs up if you got it. I tried hard. So this is how ER and PR have a role in the cell division. You got my point? You got my point? So you must ask me a question. You people, if you got it, you must ask me. तुमने नहीं पूछा, तुम्हें पूछना चाहिए. So ma'am, you mean that in breast cancer, the ER and PR overexpression is there. What I am saying, in breast cancer, ER and PR overexpression is there. Overexpression is there, that is leading to cell division, uncontrolled cell division, and increasing the cancer size, increasing the size. So cancer will become 1 centimeter, 2, 3, 4. It is going on increasing because of uncontrolled cell division, because of overexpression of the receptors, the ER and PR. Am I right? If I am right, give me a thumbs up. Give me a thumbs up if I am right. Gaurav, give me a thumbs up. You got it? Yes. So the second question, Gaurav, you must tell me, ma'am, if it is the case, can we block these receptors? As soon as we got the diagnosis in the lady, can we block them? If we block them by any method, if we block them, now if estrogen come, cannot bind here. If progesterone come, cannot bind here. If estrogen and progesterone cannot bind here, it will not divide, and breast cancer can be halted at that stage only. Now it will not further increase. We are not preventing it. We are halting at early stage. You got my point? We are not preventing it. हो तो गया breast cancer. Lady is already in front of me. She's already having a lump in her breast. So I will take that lump out. I will operate that. जितना हो गया उतना तो हो गया, right? वो तो हो गया. लेकिन और ना बढ़े. उसके लिए can I give? Yes, I can give estrogen and progesterone blockers, the receptor blockers, right? So many drugs. This is known as hormonal therapy. So in cancer, the breast cancer, we give 4 therapies, or basically 5 therapies. Number 1 is surgery. अगर कैंसर है तो सर्जरी तो करना ही पड़ेगा, कोई भी बाबा हकीम कोई कुछ भी बोल दे कि बिना सर्जरी के ट्रीटमेंट होता है, ऐसा नहीं होता। नो, इट डजंट हैपन। इफ लंप इज देयर, दुनिया में कोई दवाई उसको वापस वापस उसको डिसअपियर नहीं कर सकती। लंप कैन नॉट बी डिसअपियर फ्रॉम द बॉडी, इट इज अ गोल्डन रूल। The first thing, we know that being doctors, but I have worked in an onco center for years and I have seen several cases coming in stage 4. If I ask the ladies what you were waiting for till now, you are in stage 4. So it is not the thing you are knowing it today. You are knowing it since 6 months, 4 months, 5 months. So what you are waiting for? Why you have not come to us earlier? It is already stage 4. You are late. Why? So they say that some Baba, someone have challenged us that without surgery they will treat us. And now it got metastatic. It is involving the skin, pectoralis, throughout the body. So they just take their hands up and they are saying go to the doctors. So initially they challenged us. So the malpractice, especially I'm talking about the India, I'm not aware about the other countries. So quack practice is very common here. The jhola chhap doctors, they don't have certificates, they don't have degrees, they just verbally they just challenge people by anything. And the irony is that in our law there is no punishment for that, right? So if in future if you get an opportunity for this, make a law for the quacks also, for the quacks who are practicing, I must say the malpracticing and taking the lives of the patient. So it is very very at the time I get emotional that what these people are very innocent, you must say. The ladies are very, they are from the villages, they are from the innocence, and they were not having a good reach to the doctors. That's why वहाँ पे quack practice बहुत common है. It is very common, मतलब looking at such ladies, they have small kids, right? And they have families, right? So at that time having stage 4 cancer is very unlucky, and it is just the lack of medical services provided to them. It is the lack of awareness. And who's responsible for all that? That quack is responsible. So no one should take the challenge that without surgery it can be treated. No, surgery is the only treatment you should go for the surgery, right? Number 1 surgery, number 2 chemotherapy, number 3 radiotherapy, number 4 hormonal therapy, number 5 targeted. So this is hormonal therapy I'm talking about. Give the blocker of ERPR receptor blocker. So best drug to be given here is tamoxifen. We can give tamoxifen, right? So tamoxifen, letrozole, these are the drugs available. Give me a thumbs up. So tamoxifen is given usually. So that is about ERPR, right? Number 1, ERPR. So you can see this is a breast cancer cell. If estrogen is present in the body, growth factor, it is going to the growth receptor, they are going on dividing. But if we block them with tamoxifen, they cannot divide and they will remain as it is. So it is good to have ERPR receptor, right? But this ERPR, तो ये तो अच्छी बात है ना, तुम कहोगे मैम it is a good thing कि breast cancer में ERPR receptor बढ़ जाते हैं, we can block them, but not in all breast cancer it happen. In a proportion of breast cancer ERPR increases, in others it don't increase, right? So ERPR negative में some other role will be there जो अभी तक discovered नहीं है, some other growth factor is there, right? That is about ERPR. ERPR always travels together. You can see here, this is the estrogen receptor, listen, and this is the tamoxifen drug. I'm blocking it. Normally when estrogen comes and bind with the estrogen receptor, it is dividing. Can you see? It is going to the cell division. But if I'm blocking it, estrogen cannot bind with it and it cannot divide. So this is the breast cancer, we can control like that, right? So the blocker is in the form of a tablet. The name of the tablet is tamoxifen. So female have to take this tablet at least for 5 years or 7 years or 10 years after the diagnosis of breast cancer. So daily she has to take 1 tablet. It is very cheap, not very costly. Give me a thumbs up. This is hormonal therapy. This is normal. This is hormonal therapy. You got it. So these cancers have slightly better prognosis, which are ERPR positive. So how to judge whether the ERPR is positive or negative? Just suppose this lady is in my clinic. Okay, ये मैं बाद में बताती हूँ. Listen, इसके पहले HER2 भी सुन लो. HER2 overexpression, also known as CERB2. So it is also a receptor on the surface. Now see again, normal breast cell. On the normal breast cell, HER2 are present, but ikka dukka, very small amount. Like ERPR, very small amount, right? So when HER2 is coming, binding with the HER2 receptor, it divides. Then only it divides, but in small amount. But when breast cancer is there, the HER2 receptor increases tremendously in the same way as ERPR were increasing. Now it will go in uncontrolled cell division and it will cause cancer. So you will see, ma'am, same thing. So this is multiple HER2 receptors are present. They will go on dividing, and they will form a lump. They will form a cancer. So best thing is to block them. So what is the blocker of HER2? The blocker of ERPR is tamoxifen. Yes. What is the blocker of HER2? There is a drug known as Herceptin. What is the name of the drug? The name of the drug is known as Herceptin. Can you see it is blocking HER2? So if we give that drug, the HER2 will be blocked, and now HER2 receptor is blocked. HER2 cannot bind with HER2 receptor and it cannot divide. We can halt it. The only thing, it is not a tablet. Like Tamoxifen was a tablet. This is IV given. Every 21 days we give it IV. Every 21 days. Till what? Till 1 year after the diagnosis. Every 21 days. So 1 year में 12 months होते हैं. हर 21 days 21 days में total 17 cycles आपको 17 times देना पड़ेगा. And what is the cost? It is in lakhs, you know. So total costing here 5 to 10 lakhs हो जाता है, right? It is very costly. It is not very cheap. It is very costly, and not everyone can afford it, right? After the diagnosis, right? So this therapy is a little bit costly. Herceptin, till now it is costly, right? Government should work on that, on the cost. Give me a thumbs up if you got it. So you can see this is normal breast cell having ikka dukka, a small amount of HER2 receptor, right? During cancer they increases tremendously, but if we block them with Herceptin, if we block them, the cancer halts. But Herceptin is costly and it is not tablet. The patient has to add, yes, Trastuzumab and Herceptin is same. Yes, Gaurav, Trastuzumab and Herceptin is same. Herceptin is the brand name. Only one company is available. Herceptin के अलावा और कोई company अभी तक नहीं है, right? Herceptin, and the name of the drug is Trastuzumab. MAB. It is a monoclonal antibody. That's why MAB. It is known as targeted therapy. So targeted therapy is given. Now let's study the molecular classification. So basically, what you have studied? You have studied the 3 types of receptors: ER receptor, PR receptor, and HER2 receptor. Give me a thumbs up. Give me a thumbs up, say yes. ER, PR are always together. We cannot separate them. If ER is present, PR is always present. If ER is absent, PR is absent. It is not ER present, PR absent. No, ऐसा नहीं होगा. They are always in pair. But HER2 can be differentiated from them. Give me a thumbs up. So based on that, we divide the breast cancer out of 4 types. Listen everyone here, the master slide. The breast cancer are of 4 types. Luminal A, Luminal B, Basal, and HER2. Right, Luminal A are the category of breast cancer in which ER/PR is positive but HER2 is negative. ER/PR is positive but HER2 is negative. Can you see this is ER/PR column, this is HER2 column. So ER/PR positive है, HER2 negative है. Can you tell me the treatment of this patient? The maximum patients are this category only. So you will give Tamoxifen to them. Tamoxifen tablet to them for 5 years, 10 years. But you don't give Herceptin. No need of Herceptin. Don't give Herceptin. तो इनको costly वाला treatment नहीं देना है. Tamoxifen is very cheap. Give them for 5 years or 7 years or 10 years. Different protocols for different ladies. So that is divided by the oncologist. Give me a thumbs up. Prognosis is good. The prognosis is good. You can halt the cancer. You cannot increase the cancer. The chances of metastasis are very less because you are halting it. Next 5 years, 7 years, the lady is on this tablet. She is taking it regularly. She will not have metastasis because you are halting the growth of the cancer. Give me a thumbs up. And it is cheap. So the best, luckiest ladies are this one. Among the cancer ladies, the best are those जिनको नहीं होता है, लेकिन होता है तो उनमें these are the luckiest one, क्योंकि सस्ते में ट्रीटमेंट हो गया और अच्छा ट्रीटमेंट हो गया और चांसेस ऑफ रिकरेंस आर लेस. Give me a thumbs up. The second is the Luminal B. Luminal B are ER/PR तो positive है ही है. ER/PR is positive, but HER2 is also positive. So what is the treatment to this ladies? You will offer Tamoxifen also to them in the form of the tablet for 5 years, 10 years, whatever, right? You will offer Herceptin also for at least 1 year. Herceptin is very costly. You have to offer them also. So ask them to take both treatment, right? So second best prognosis, I must say, right? Second best. Not very lucky, but yeah, if the affordability is good, they are lucky, right? Because Herceptin is costly, right? But if they are not affordable, they are belonging to a poor family, they will say no, we cannot afford the Herceptin. We can afford only Tamoxifen. So they will not take Herceptin, and chances of recurrence are there if they don't take Herceptin or Trastuzumab. Give me a thumbs up. The third category patient are Basal, the worst, the most unluckiest one, the worst one. They are ER/PR negative as well as HER2 negative. Don't offer any drug to them. You will say, ma'am, offer any drug, ठीक है, पैसा नहीं लगेगा, लेकिन chances of recurrence are very high. Because you will say, ma'am, in them, what is the growth factor then? We don't know them. Still, it is under discovery. Some other growth factor is monitoring the growth here. So some growth factor will be there, some receptor will be there, but we don't know what is the receptor, so how can we block them? So it is not ER/PR, it is not HER2, it is something else we don't know. Till now we don't know. Give me a thumbs up. These are also known as triple negative breast cancer. Triple negative breast cancer, TNBC कहते हैं इनको. Because all 3 things are negative, ER, PR and HER2. And the last category, the fourth category, क्या बच गया? Fourth category, HER2 positive. So you got it. It's ER/PR negative but HER2 positive. So here in treatment you will give only Herceptin. It is costly, but yeah, the treatment is available. Not trastuzumab or no tamoxifen. Give me a thumbs up. So either you are giving only tamoxifen, either you are giving only Herceptin, either you are giving both, or either you are giving none. Right? So that is the treatment. One is oral, one is IV. One is cheap, one is costly. And that decides the prognosis. So prognosis depends little bit on the affordability also, you must say. Give me a thumbs up everyone. I tried hard. This is the molecular classification. You can describe in your own words. So what is luminal A? Come on. Luminal A are ER/PR positive but HER2 negative. But HER2, these are the 50% of the patients are in this category only. 50% are luminal A. These are the luckiest one, the best one. That's it. In the treatment, you will give only tamoxifen. That's it. Luminal B are HER2 positive as well as ER/PR. These are triple positive. The second category, these are triple positive. Right. The third category, baseline. These are triple negative. These are triple negative, the worst one. And the last one is HER2 positive. Only HER2 positive. Give me a thumbs up. So these are the four categories. Can you enumerate? Can you enumerate the molecular classification? It's luminal A, it's luminal B, luminal A, luminal B, basal. Basal को slash करके लिखो triple negative. Luminal B को slash करके लिखो triple positive. Right? And last one is HER2 positive. HER2 enriched. HER2 enriched or HER2 positive. Can you classify them? So yes, tell me what about ER and PR and what about HER2 in each of the category. Osama, Gaurav, can you help me? Any one of you guys? MM, what about others? I can't see other name. Yes, luminal A is ER/PR positive but HER2 negative. Right? Triple positive is all positive. Triple negative is all negative. Right? And HER2 enriched is ER/PR negative but HER2 positive. You got my point? Yes. And you know the treatment of each of them, you know the prognosis of each of them. This is molecular classification of breast cancer, the ultra important topic nowadays. Right? So I must stop here. The histopathological classification I will take on some other day. Today we have learned the risk factors, the general features, the structure of the breast and molecular classification of the breast. The most important thing. Give me a thumbs up. So here I would like to stop. If you have any doubt, don't forget to ask your doubt on this contact number. It's 9833032948. And if you have any doubt in patho, pharma, micro, PSM or medicine, you can ask here. Don't forget to tell me your college name, your university, your exam dates. I can give you a schedule for you. And if you have any trouble in your exam, study related doubt, like if you have some trouble in scheduling how to study, in how much time I should finish one subject or whatever, you can text me, right? You can connect me on the WhatsApp or Telegram, right? So here I would like to stop. Thank you very much. If you like the lecture, don't forget click on the like button and share with all your friends, colleagues, subscribe our YouTube channel and press the bell icon. See you. Bye bye. Study hard. All the best. I'm ending this session.